I can see Sue and Lorraine, and we just bear with. We're just waiting for Yolanda.
I'm here. Can you not see me?
Can now.
Oh, good.
You're kicking us off. Compare.
Have we gone live?
Yeah.
Oh, sorry about that. Welcome everybody, and as always, please put questions in the chat. And I'll hand over to you first of all, John, for you to give us a bit of an update.
Thank you. Afternoon, everybody. Welcome to this week's edition of Exec Q&A. So today we've got Maria Newham, Director of Nursing Quality and AHPs. We've got Sue Elcock, Director of Forensic Services and Medical Director, and Lorraine Hooper, Director of the Money, IT, Digital and Estate. We haven't got loads of questions in the chat, so feel free to put questions in there and we'll have a go at trying to answer them. And as ever, I'll start off by just giving a sort of brief overview of how we're doing, scores on the doors, all that sort of stuff. As I'm sure you'll be aware, there's been a lot going on in the health world over the last week or so, with a sudden change of Secretary of State, which, as you can imagine, I think will put some increasing uncertainty into the sort of very senior top leadership in terms of new person coming in after having someone that's been in place for some considerable time, that's particularly familiar with pandemic COVID response, and the new secretary coming in having an awful lot in the inbox and stuff to sort and being new to it. So there's some sort of sensitivities at a national level, and that also is exacerbated by the chief executive of the NHS England Improvement, Simon Stevens, who's about to retire from the post, and they're currently out to advert for that. So the two most senior positions nationally are new or soon to be. You might think, oh, that's all a bit esoteric, John, and what does it mean for us? Which will be a good question. But it's that uncertainty will have impact across regions and into local systems. At times of uncertainty, there's, for example, people become a bit more risk averse, and there'll be a bit more request probably for further information, further mitigations, tightening around the money. So there's all sorts of things to look out for, given that we're about to embark upon this transformational change to the way the NHS is organised anyway, with the ICSs becoming statutory bodies through the by April next year. I mentioned that previously. Closer to home, you'll have seen as well the numbers around the COVID cases have started to rise quite steeply nationally. I can't remember exactly what the number was yesterday. There was something else on the TV which I think obscured any pandemic news and caught a lot of people's attention. But I think we're at about 16, 17, 18,000 new cases as a rolling average per week now. And that's almost entirely Delta variant, and has quite significantly increased rates in the younger age group. So the good news about that, if there can be, is that that's not being translated directly into serious illness, hospital admissions, and certainly not deaths as it was previously. So there's some good emerging data that total alignment between cases and death has been broken by the vaccine. So that puts us nationally in a much stronger position than we were, for example, this time last year, when although the numbers were falling, there was no protection. The rates across the county and in the East Midlands are pretty much aligned to the national average. There's some hot spots, there's some cooler spots as it rattles around. Like I say, the younger generations, there's a massive national push now, again, very politicised around the vaccination rates. In Nottinghamshire, we're in sort of mid-pack in terms of the other, compared to the other systems in the Midlands region, but the target is for everyone to have been, well, to 85% of the adult cohorts to be have been offered a vaccine by the 19th of July. We're on track for that in most of the age cohorts across the county. Apart from the lower ones, largely because two main reasons. Those cohorts haven't been open for very long, the 18 to 29s and the 30 to 39s, but also there's much more increased hesitancy in those populations, as I'm sure people will be aware. Within our organisation, the message is still the same. If people are still hesitant, we've got lots of information, expertise to advise people if there's questions that they want to ask, not necessarily on this call today, but don't be shy of trying to clarify things, and also to be clear that if you're thinking, oh, I've missed my age group, it's an open season now. If you're over 18. You can drop into any of the centres and get vaccinated. You don't need an appointment. And there was a big push on that over the weekend. And then within my last bit, Yolanda, before I go back to you, is just organisationally. I think it's really worth mentioning that not just within the healthcare trust, but across the whole system, organisations are really under the pump at the moment. There's an awful lot of pressure. Again, whether you're in primary care, whether you're in community mental health, learning disability services, the demand is literally going through the roof. So the rates of 30–40% increase compared to what would be sort of average for this time of year is across the piece. So there's more people coming through, and there's more people who are more acutely unwell, and that's being felt right across the system. So we need to make sure that in terms of our leadership and in terms of how we're helping support each other, that we support our staff, because these are really tough environments to work in. And I just wanted to say that I had a really positive visit to some of mental health, learning disability divisional services earlier in the week, so starting to be able to come out again. I know we've got to be very cautious about those sorts of things with regards to social distancing, but I got to see the bed management team at Highbury Hospital and the city and county crisis teams, who are all doing a phenomenal job, and it was just a really important reminder to me. Just some of the daily 24/7 work that our teams are having to manage and absorb and resolve is really huge at the minute, and there'll be some things as a response to that we need to make sure in terms of supporting our staff across the piece, and that we do that well. So that's probably as much about by way of introduction, Yolanda, to kick things off. A big, huge thank you to everybody, not just in those clinical services, obviously, that I've mentioned, but across all our support, corporate services, all our clinical teams, for the fabulous job that they're doing. Thanks, Yolanda. Back to you.
Thank you, John. My Teams is playing up, and I can't. It still says I'm trying to connect, and I can't see anything. So I'm not quite sure what's going on, but I'll try my best to muddle through. The first question, John, is for you about how did the Nottingham big vaccination go at the weekend? So if you could please just give us all an update on that, that would be fabulous.
Switch my mic on. Just to say, Yolanda, we can both see and hear you, so you're connected to us even if you're not feeling connected. But just shout up if it's not working.
But you
the vaccination weekend. So this was a national push to get to those numbers that I mentioned earlier, and we had a open all our centres 8 a.m. to 8 p.m. over Friday, Saturday, Sunday, Monday for 4 days with the big media blitz. Some really good examples of working with local stakeholders. So, for example, some of the city council volunteers and other officers in their teams were doing door knocking in localities where we knew the uptake was low, often in quite socially disadvantaged and vulnerable populations across the city, in Mansfield and elsewhere. So overall, we had an additional 6,000 people attend, in addition to those that were already booked, which was really good news, because otherwise there'd have been 6,000 people that would have been without the vaccine. Just talking to the vaccination teams, though, this is really interesting. The people providing this service were a bit disappointed, because in terms of the capacity that they were knocking out a few weeks ago, they felt this was a relatively low number. But in terms of comparison across the Midlands, we were the highest performing county in terms of additional walk-ins that we got per head of population. So it was a real positive story. But I think, again, it continues to sort of confirm this. There's greater hesitancy in the younger cohorts, and perhaps also a sense that, by and large, the pandemic's done. We're all coming out on the 19th of July. We don't need to worry about it so much. And again, despite the fact that cases are quite high in these groups, there's also a sense that because people aren't getting admitted to hospital and not dying, that it's an okay condition to have. But that isn't the case, because we know that there are an awful lot of different symptom profiles and a large number of people that can have post-viral conditions, whether it's called long COVID or other longer term effects that can be really tricky for people to manage. So our stance continues to be organisationally, make sure that you avail yourselves of the jabs. It's not mandatory. We hope that we can persuade people to have them. Tell your friends, tell your peers. It's a really important thing that you can do to get vaccinated. There'll be more, probably not quite in the same vein, big vax, whether it's weekends or days, as we approach, we get closer to the 19th of July. As I said in the intro piece, this is such a high national priority, and there's big politics behind it. And as ever, being a public service, we become part of that. Thanks, Yolanda.
Thank you, John. Now I'm going to move over to the COVID question queen, Anne-Maria, for a few questions about COVID, and particularly track and trace. So somebody's put in a question saying that they've been contacted by track and trace and told to isolate for 6 days. They've had both their jabs and they do wear PPE at work. Should they go to work or not? Thank you, Anne-Maria.
Thank you, Yolanda. So what's crucial in this question, and I'm glad somebody's asked the question, is that you must turn off your NHS app when you're at work, because what it will do is, if you leave it on, it will pick you up as a contact and ask you to self-isolate for the however many days it has been since the contact. That's why 6 days in this case. So that's the first important thing, is you must turn your app off whilst at work. Now, I think on this occasion, this member of staff did turn their app off. They were wearing PPE, and they were adhering to all the guidance required. So unfortunately, in this circumstance and this incident, the person would have to isolate for the amount of days that the NHS tracing app has told them to do. So 2 things here. Yes, that person does need to isolate. And the second thing is that if you have turned your app off and you are wearing PPE and you are at work and it then tells you that you've got to isolate, you will have to isolate. And I'm really sorry about that. But it means that you've been in contact, not at work, but something that you've done elsewhere in Asda, Tesco's and the pub.
Thank you, Anne-Maria. Sticking with you and sticking with the subject of double vaccinations, the government is considering allowing double vaccinated adults to avoid quarantine after travel to a country on the amber list. What will our organisational stance be on this, please?
Thank you, Yolanda. So we do not take a individual trust stance. We take the government guidance, which is adhered to by all trusts. So we wouldn't apply something separate or different. Currently, the guidance is that nobody should be travelling to amber countries for any leisure. And we are saying exactly the same. And we will just await any new guidance that comes out from the government. I too would very much like to go and see my family in Holland, but as it is an amber country, and what they say as well is not just about the country you go to, it's about when you come back into this country, what is then applied to you as well. So it's really, really important. And I think at the moment we're not seen as particularly a clean country. So quite a lot of the European countries are looking at us as being high risk. So we won't do anything different to what the government says.
Thank you, Anne-Maria, for that clarity. You're off the hook for a few minutes while I direct the next question, which is COVID and working from home question, to Lorraine, if that's okay. Lorraine, there's a question in the chat from Catherine Thornton about if we end up with hybrid working, will the trust be able to negotiate with office furniture companies to ensure we can buy good quality supportive chairs to work at home with? She says she's got one that she got through the organisation, but she's assuming she has to bring that back to work at some point.
Thanks, Yolanda. So
thank you, Lorraine.
We're, as you can imagine, working through an awful lot of estate with an awful lot of staff, and I'm sure you and your teams are having conversations about how and when you return to offices. And as part of that, we'll need to have conversations about exactly what furniture everybody needs on a more long-term basis. I'm sure we all remember 15, 16 months ago upping sticks and getting out of the office really quickly, and we absolutely will be considered in that. And how we do that, whether we negotiate with office furniture companies or we buy through the trust contracts, we will do that, but we will absolutely do that in line with our agile working policy and recommendations for individuals that have specific needs to be supported with furniture.
Thank you. Lorraine, if it's okay, I'll still stick with you. The next question is about payroll and the recent error that occurred. Just one person has contacted. I've seen there's been quite a lot of chat on the staff Facebook group about it, and I think most of the queries and questions have been resolved. But a member of staff has contacted us to say that they still haven't been paid their enhancements following the payroll error that happened last week. They're asking when they can expect to receive them. And I just wonder whether you could answer that question probably more in general terms.
Yeah, of course, Yolanda, thank you. So unfortunately, at the end of last week on payday, a small number of our staff who are paid enhancements weren't paid those enhancements correctly. I'm really sorry about that. That's not a good thing. It's not the standards we hold ourselves to in the payroll function, and the process that we've got in place has been adapted and changed with immediate effect. All of those that have been affected by that have been contacted, and all of those that were underpaid should have received their sum of money that is the enhancements that they were owed, and anyone that was overpaid will have that deducted from their salary in July. If you haven't yet received your money, I'll drop in the chat in a minute the general payroll query inbox that you can contact in order to get a response. And as we always see with payroll, when we all get our pay slips and we have a look, don't we? And sometimes there are things in there that we don't recognise or we don't understand. So I'm sure as well there'll be a number of individuals that are in contact with payroll as well about some of those things. So I'm have spoken to the payroll team this morning, and they are They are working through those more general queries that we would get every month as well. But I'll drop that email address into the chat now for everyone.
Thank you, Lorraine. A call out for any more questions. We've just got one more question that's been sent in advance. So if anybody has got any more questions, please drop them into the chat over the next couple of minutes, please. That'd be great. The last question that we've had in advance was asking about our plans for the NHS is the 73rd birthday in July. So for those that don't know, the thank you day for NHS staff is on the 4th of July, followed the following day by the NHS 73rd birthday, which falls on the 5th of July. So across the country, everyone's using that as a chance to say thank you to the NHS, and also NHS staff thanking each other. We've got quite a few things planned within the organisation, so I'd like everybody that's on the call and their teams, please, to get involved as much as you possibly can. So we're creating a wall of thanks on our website where we're asking staff to share their messages of thanks to their teams and people that have gone above and beyond over the past year. We're also producing some electronic postcards for staff to download, so you can send personal thank yous to teams and individuals. We're also asking everybody across the organisation to share any inspirational stories that they've got on social media if they've got it themselves, but if not, they can send things through to the comms team and we will share them for you. There's loads of information on Connect, and finally there's an NHS Big Tea Party on the 5th of July, which is an opportunity for staff to come together, either virtually or in person, but Anne-Maria will kill me if I don't say that it's socially distanced, of course, and celebrate the anniversary of the NHS, as well as what we've all achieved over the last year. So if anybody is doing anything and they'd like to promote it through the comms team, please just let us know. I'm just going to quickly check the chat for anything else. Lorraine's popped in the payroll queries email address, so thank you for that, Lorraine, much appreciated. Neil's put a comment in, Anne-Maria, I think this might have been in relation to the question about masks and things. I'm not sure whether there's anything different to add, but we're just going to be following national guidance, aren't we, on that? So I think we've covered that off, but thank you, Neil, for the question.
Yeah.
And
just to say to Neil, just a bit of a, we are keeping an eye on what everybody else is doing, Neil. So I do appreciate you putting that in there about Cambridge. And we're waiting to see from both NHS England and Public Health England if they're going to change the guidance for all trusts. So the problem we've got is that a couple of trusts have individually made decisions, but we can't do that. We're waiting for the national guidance that we will adhere to. So, but that's a huge thank you, really, for pointing that out.
Anne-Maria, Neil just put another question in just right now that says, are we taking a view about RIDDOR and whether we report the cases under RIDDOR, staff cases?
I know that Claire answered this before from a HR perspective, but if staff are, if it's shown that staff have caught COVID whilst at work through no fault of their own, you know, for example, if it was done within or let's just say a restraint or something like that, and they've needed to go home and have time off sick, then yeah, absolutely, Neil, we are recording that as a RIDDOR. I'm not aware that we've needed to do that for some considerable time. And of course, what John said at the very beginning is we are starting to see some cases, but I've not seen anything for quite some time that that has meant we needed to record it in that way. But we would record it if it was shown that staff caught it at work through no fault of their own.
Fabulous, Anne-Maria. Thank you for picking that up as well. That's all the questions that we've got so far. I'm not seeing anything else coming in. John, can I hand back to you to sort of sum up today's session, please, if that's okay with you?
Yeah, thanks, Yolanda. I thought it's not summary because I've not mentioned it previously, but it's just occurred to me whilst thinking about what sort of headline things, not mention the CQC. And whilst we know getting tongue-tied here. Let's start again. Sorry. Whilst acknowledging that there's really challenging environments and workload at the moment, we shouldn't shy away from the fact that the CQC nationally are out inspecting again. They're at local mental health trusts neighbouring in Leicester. We're getting lots of intel back from national colleagues about some of the rigours that they've been put through by the CQC in terms of their inspections. And we've just started a task group to really start to focus on getting battle ready, as it were, that Anne-Maria and Sue are leading from the quality perspective of CQC. And just to really flag for people that they will be coming. We don't exactly know when, but where they go is based on a number of things, not least their own internal sort of risk profiling. And we know that we're at fairly close to the top of that list, given our current ratings, some of which are very historical, but nonetheless, we should be getting prepared for them to come at any time. So one of the changes in recent times is that when they talk about unannounced visits now, they are unannounced, whereas previously, although they were called unannounced, I would get a call or Anne-Maria would get a call saying we're coming in a couple of days. But we know they are turning up, and they're turning up not infrequently out of hours for their first visit, late in the afternoon over the weekend. So again, it's a call to arms to sort of make sure all your people are aware that if someone comes to a ward or a team on a Saturday afternoon saying they're from the CQC, then obviously check it out, but with their identification and such like. But that we know that that's happening. But the other equally important thing to state about this is that we shouldn't be wary. We've got an awful lot of great things to showcase from a CQC perspective, and part of what our task is over the coming weeks is to enable people to be as confident as they can be if they get thrust in the spotlight of a visit, in terms of explaining the great work that we're doing, because it is an opportunity to tell that to the CQC. They come from a very neutral point that organisations are good. They don't come purposefully to trip you up and find bad things. And we spent a lot of time both in our team, and I know teams have across the organisation, in building that confidence, but also working with the local CQC inspectors to keep them informed of the things we're doing. And it's a bit of a cliche from me, but it's not necessarily that we have issues. They expect all organisations to have issues and challenges that they're working on. It's how you respond to them. So again, for example, some of the work that we start to do on closed cultures is really, really important. We won't have got it all resolved and ticked and green by the time they come, but it's having that confidence to talk about, these are the issues, this is how we identified it, with your help, thank you. But these are the things that we're doing. This is where we're going to get to by when, and these are the benefits that our patients and our staff will notice. So there'll be more of that over the coming weeks and months, and just for people to look out for it in terms of seminars and sessions on Teams, particularly where we can share some of that love. I don't know, Anne-Marie, is there anything else you want to say about that? I haven't got anything else to say, Yolanda, by way of summary. Thank you.
I can add a couple of bits really. So John's right, they do turn up, they just bowl up. There's a trust that's not far from us, that is a trust very similar to us, that had their unannounced a couple of weeks ago. And in fact, the core services were all inspected, all done and finished. And then last night, they actually bowled up at their mental health unit, totally unannounced in the evening. So they can don't breathe a sigh of relief when they've gone, because they can just come back at any time. I suppose that's where I'm going with that. And then just another one as well. They're also inspecting in a very different way sometimes with regards to pathways. So starting kicking off this, I think it's this Friday. Yeah, this Friday kicking off. They're doing the CQC inspection of the mental health for children and young people's pathway. So that's across all of the services that deliver anything to do with children and young people's mental health. So that's us, that's the local authority, CCG, both the other providers. So it's an actual inspection of a pathway, and it's being led by the lead inspector that's also our inspector for our trust as well. So they're just doing things slightly differently as well, and coming up with risk assessments. So they risk assess us to see how risky we are. But I've been saying to a lot of people is that, you know, we do welcome the inspection, because it means that we get ratings, you know, hopefully improved, because that's the whole aim of it. That's the idea of it, is that they help us to understand how we can improve, and we can show them those improvements that we've made. So yeah, that's just pretty much it, really.
Thank you. I think that's everything covered, and thank you for summing up, John. So that's it for today, folks, and join us again in 2 weeks' time. Thank you very much, everyone.
Thanks, everybody. Bye.
Bye.